Next from Springfield, we talk with Jennifer Creasy, a policy analyst with the AARP, about the beginning of the state's healthcare exchanges, a part of the president's healthcare reform. She tells us how individuals can use the exchange to purchase health insurance and to compare prices. This runs about 25 minutes.
Jen Creasy with AARP, thanks for joining us again on the Illinois Channel.
Thank you for having me.
Last time we spoke, and we're going to speak again, we talked about the healthcare exchange, sometimes known as the Affordable Care Act, part of the Affordable Care Act, I should say. Some people refer to it as Obamacare, just so we all know what we're talking about. It's the implementation of the Healthcare Act that was passed by Congress and proposed by the President. And here we are now in October of 2013, and we are at the deadline for signing up. Before we get into some of the specific details that people should know, let's just, I guess, remind people, as a short overview, why is this law even going into effect? What is it supposed to achieve?
Yes, well, when the Affordable Care Act passed Congress a few years ago now, we talked about how it would be provide more available, accessible health insurance coverage. And now the day has come. We are at the starting line of the marketplace to be implemented. The open enrollment will start October 1st, and it will provide a place where people could go to find health insurance if they need to purchase health insurance on their own, or if they have a small business. They'll be able to go to what is going to be referred to as an online marketplace. In Illinois, it's going to be called Get Covered Illinois, excuse me. And they'll be able to go to this website and shop for health insurance that fits their and their family's needs. So there'll be a number of different health insurance products in one place, side by side, where they can compare and contrast and decide what works best for them.
I think one of the points of confusion, and there's a lot of points of confusion, so we're not going to try to take apart the entire bill, just so people know, but we're really trying to focus on the implementation of the healthcare exchange. That's a term that doesn't really, I think, describe what it is, and so let's just try to make it clear. If I might say so, and then I'll have you elaborate. So, first of all, it's a website where people can compare side by side health insurance from private carriers. Is that correct?
Yes, it is. It's a good way to think about it as an online shopping mall. One place where you could go to see a bunch of different products. It also could be compared to a travel website, say Expedia.com. If you are looking for a flight to Florida and you are willing to pay top dollar for a first class nonstop flight from Chicago to Florida, you could do that, or you could look and see if there's cheaper flights available with maybe a layover in Atlanta. You could see different combinations, different products that fit your best needs.
All right, so let's use that as an example. People would know, and you say, you could fly first class, you could fly business class, you could fly coach.
Yes.
And there's different ways, as people would know, to lower their costs. Maybe they could say, I'll accept a one-stop, but you're going to pay more if it's nonstop. On that travel website would not be listed a flight provided by the government. There's not a government airlines. Is there going to be a government plan, or are all of the plans that are offered private insurance companies?
Yeah, the government is not providing any insurance product itself. All they're doing is providing the marketplace to go and shop for the insurance. So the Get Covered Illinois brand will be a place where people in Illinois can go to see all of the private insurance products that are available to them. Now each product offered in the marketplace must also be offered off of the marketplace. So the insurance companies have to do both. If they do one, they have to do both. They also have to include a core set of benefits that include doctor's visits, emergency services, maternity and newborn care, just to name a few. So these 10 set of core benefits have to be in every single plan.
the basic idea, whether it's achieved or not, we're not making a value judgment on that, but the basic concept would be, I think, a point that at least a lot of people would accept, as they do in another venue, to add greater transparency and competition so that you can compare, as we use the analogy of the airlines.
Yes.
I was using off camera an analogy, if someone does car shopping, you could go to 6 different car dealers, which is time consuming. I mean, maybe that's the way you want to do it anyway, to actually look at a car and drive it. But as a starting point, you might go to a website and see, if you're buying a mid-sized Buick, you could see that same model being offered from different car dealers. So
Yeah.
as just a concept to demystify and try to make it clear, that's what this website is trying to do.
Yes, it's really just trying to make it easier to find the insurance product that best fits you and your family's needs by offering this one-stop shopping. Now, it's still going to be complicated, so there will be people in the community that will help people sign up for health insurance. They will be called navigators and in-person assisters or counselors, that if you have questions, you can visit one of these navigator sites and they can help walk you through the process.
And that, again, you're not visiting them in person, you're visiting them, you call in on the phone, how do you?
You can visit them any way you would like. In person, on the phone, would probably be the two best. I don't know if they'll have email opportunities, but in person, so that you could sit down and you can both look at the computer and walk through it, might be the best way to do it, or by the phone.
Now, people are going to be, we call it open enrollment, which means, so we're starting.
Yes, the starting line.
People can sign up as of October 1.
Yes.
And the open enrollment stops at a certain point and then it reopens. Is that how that works?
Well, for the first year, there will be ample opportunities to sign up for health insurance. Open enrollment begins on October 1st, and from October 1st through December 15th of 2013, you can sign up. If you sign up during this time, your health insurance will be effective January 1st, which is when the law really goes into effect. But if you don't have time to sign up before then, you can still sign up through March 14th, and then your insurance would be effective the first day of the next month, if that makes sense. There will also be a second special open enrollment in the fall of 2014. So if people miss the first one, or if their circumstances changed, they can go back and sign up for the marketplace.
And now, I think there's some confusion. Let's say that someone already has health insurance provided, either they're buying it themselves or provided by their employer. Do they have to do anything?
No. If you already have health insurance provided by your employer or some other entity, if it's Medicaid or Medicare, people on Medicare especially, they do not have to do anything. This is only affected by people who have to purchase their insurance on the open market. So if you're an individual or if you own a small business. But again, if you already have health insurance, you do not have to change and you do not have to do anything.
What about an employer? Let's say I have a small business and I am providing health insurance. Am I supposed to fill out some form or paperwork that I have to provide to government to verify that I'm providing insurance? Because we hear that there's going to be a fine if you don't provide insurance.
Yes, the individual mandate will be in place in 2014 for both individuals and small businesses over 50 employees to provide health insurance. But I believe that they will catch that on your taxes and you won't have to do anything extra. If you're already providing health insurance, I would say to just keep doing what you're doing, and you're satisfying the law.
And as far as people going to, I think we mentioned the website a little bit earlier. Let's mention again, we can have it in a graphic form, but what for Illinois is the website?
Well, we don't have the website yet.
It's
going to be coming, but it's going to be called Get Covered Illinois.
Do we know approximately when that would be up? Or?
It should be up October 1st.
Okay.
Is when we're waiting for it.
And again, we're taping this just before October 1st, so hopefully when this is airing that it is up.
Yes.
As anyone understands, anytime you're launching any kind of business or enterprise. There's always glitches, I'm sure, in the process, and there's been a lot already where the federal government has enacted that we're going to delay various implementation aspects.
Well, in Illinois, we're also in a unique position because we are a state-federal partnership marketplace. So the state needs to work with the federal government, HHS, in developing all of these tools. So by having two entities, I think that does slow things down a little bit, but Illinois is actually in a very good place with their computer system, and by connecting this new marketplace to the other state systems that are already in place, there will be a one place where people can go to this Get Covered Illinois website, and they can also see if they qualify for Medicaid or other state programs.
Now, if someone, in essence, the government is saying you must have health insurance, is that right?
Yes.
And that's the federal government. Now, if someone says, hey, I can't afford it, how do they get it?
That's a great question. So under the Marketplace and the Affordable Care Act, there are a lot of options if you cannot afford it. For the main thing is there's subsidies on the exchange. So depending on your income level, you will be able to receive help in purchasing health insurance. The point of this is not to let anyone go bankrupt. It's to provide affordable health care for everybody, to provide options. So I urge everybody to go shop on the Marketplace because there should be something that you can afford.
Let me interject. When you say subsidy, so let's say that something's going to cost me $250 a month,
Yes.
just to pick a number, and I say I can't afford that. Would the government, would I sign up with XYZ insurance company, and the government sends them a check to help pay for it? Do they send me a check and I include that? How does that subsidy work?
Well, that's why I would work with the navigators in your community to make sure that it's all set up correctly and that you are receiving it. But I believe it's through your taxes that you would be receiving the subsidy. So you would get help before you had to pay for it. You wouldn't have to pay the insurance company any more. They would take that subsidy off of the full price.
And when you say it's going to come off your taxes, so you're saying the subsidy would be in the form of a tax deduction?
Tax deduction in most cases, but again, I would work with the navigators because every circumstance is different, and everything's are different depending on your income level, on what help you are able to receive from the government.
A couple of other questions. One, the price is not the same for everyone. It's dependent in part your age, but also it's going to be dependent upon where you live. So the price in Chicago for two people who are 28 years old and single men, let's say, one living in Chicago and one living in Springfield and one living in Carbondale, they might have, even though on paper they're the same kind of person, they're going to have three different prices. Why is that?
There's geographical ratings when it comes to health insurance. There always has been. That is one thing that we're trying to change, but in Illinois there are, I believe, 8 different rating areas, and the prices do vary, but not by a substantial amount, I believe. But yes, that's why it's imperative that you put in all of your individual specific information because the circumstances change for everyone.
I was going to say, not that I understand all of this, but people might know that their car insurance is going to also be based upon where you live. In that instance, there might be various factors that add to why your car insurance is priced, and so basically there are other factors within the context of pricing health insurance.
Yeah, your car insurance is already doing that.
And again,
and so is your health insurance.
Just like with that, and again, this is provided by private health insurers. Now, those private health insurers, are they all included? In other words, if we had 20 different health insurance companies operating in the state of Illinois, would all of them have to be providing a product, or can some of them say we're not going to participate?
Yeah, it's up to them. They can choose whether or not that they participate. The only stipulation is that they have to offer the same product on the exchange. They have to offer it off of the exchange.
Do we know that there are going to be health insurance companies participating, or is it possible we launch this website and everyone says I'm not playing?
No, we know that there will be health insurance companies participating in Illinois. I think it will be a great a great marketplace.
And then if I sign up with ABC Health Insurance Company that I found on the website, do I send them a check just like I would if I signed up with them directly, or do I send it to someone else?
I believe you would work with them directly on that, but I'm not sure. I haven't been able to play with the website, but yes, the government won't take any money.
And again, we're not making value judgments. I know a lot of people, this is one of the most controversial pieces of legislation ever enacted in the history of the country, so there's
Right.
all kinds of fair criticisms.
Right.
We're just trying to explain as it's being implemented what's happening. And there's going to be a lot of confusion, and you're
Yeah.
not the font of all knowledge. I mean,
Right, exactly, yeah.
So this is where we have some of these people that hopefully who are being trained can answer some of the questions.
Yes.
Because there's going to be other issues removed from the implementation of the healthcare exchange. In other words, if you say, I want to get coverage for a particular operation or treatment, the health insurer might say, no, we're not going to cover that, just like they did before. Or is there something else in this law that says, no, you have to cover that?
Well, it depends on what product you buy. That's why it is important to, when you're choosing your insurance, to look carefully at the fine print and see what is covered under the different products that will be available on the marketplace. One thing that the insurance industry can't do now as of January 14th is they cannot deny your coverage because of a pre-existing condition. They have what is called guarantee issue. So they have to issue some sort of health insurance to everyone. They also can't cap the amount of money spent on you in your health coverage. There will be no longer any annual limits. So right now, if someone has these annual limits on their plan and they get cancer and they're going through chemotherapy, which is very expensive, and they hit their limit, then they're out of luck. The insurance companies just stops paying for their health care for that year. There's also lifetime limits that won't be in effect anymore. So that is what's very important about this law, that everyone will have access to some sort of health insurance.
You brought up a couple of points I want to follow up on, and we touched before on the analogy of air flight, and you could go coach, business class, or first class. There are also going to be those criteria in the exchange, right? What is it, gold, silver, and bronze, almost like the Olympics?
Yep, platinum, gold, silver, and bronze.
So four different categories. And again, the platinum is the best, and the bronze is the least. It's going to be the most affordable, but give you lesser coverage. On the other hand, with the bronze, do you know what the difference is? Again, I know you don't know everything under the sun of this, but even under the bronze, there would not be a yearly limit, right?
Right, yeah, no, there will not be any annual or lifetime limits, and no pre-existing conditions exclusion.
So what would be the
Under
difference?
all of
Is it that there's going to be a higher deductible, that you have to pay more out of your pocket
Maybe.
on bronze?
Yeah, I would believe so. Again, without looking at the specific plans, I can't really answer that, but yes, you'd probably pay more out of your pocket, a higher deductible. You know, you kind of get what you pay for type of.
Again, there's going to be these navigators, so a lot
Yes.
of these questions, we can't answer every conceivable question someone might have.
Right.
If someone has a pre-existing condition right now, and I want it because maybe they're covered by the firm they work at, but we've heard a number of these companies say we're going to be dropping our insurance. They just may be dropping it entirely and saying, employees, you're on your own to go out and on the exchange and buy it.
Yeah.
If someone has whatever, let's say they have cancer, or whatever pre-existing multiple sclerosis, and they go now and apply, the insurance companies will have to take them.
Yes.
As you said, they cannot exclude them. And so that's one of the key differences, that before, had they been dropped at work and they went out, a company might say, we'll insure you, but we're not going to give you any coverage for a year
Absolutely.
because you have a pre-existing condition.
Yeah, this is one of the best things about the Affordable Care Act in general, is the no pre-existing condition exclusion. Because, yeah, who doesn't have a pre-existing condition? especially our members that are 50 to 64 affected by this law. This is very important that they will now be able to receive health insurance.
And if they are, again, and just to reiterate, but let's say someone's working for the state and they have health insurance provided, if the state continues to do that, or if their employer continues to do that, then basically their life is, I started to say unaffected, that's not true, but
Yeah, they don't have to do anything.
they don't have to do anything.
Yeah, same with people on Medicare.
What about this? If they were working for XY, a company, and they had health insurance, and there was a cap on their insurance. Let's say they had we're not going to cover more than $1 million a year. Is their plan going to change now? Even though in other words, I'm working for, a small printing company and they're paying for my insurance, but there was a cap of $1 million a year on how much expenditure.
Yeah, there's no more caps.
There's no more cap, so that's
Yeah.
going to change. So would the insurance company's rates go up? I don't know if you would know that.
No, we don't know that yet. We're still waiting to see
might.
that. We're still waiting to
So
see
the
the
Affordable
specific
Care Act
numbers.
might make it unaffordable for a company. I mean, we're pretty much focusing on the exchanges, but there could be some of those issues where it changes the cost structure because there's going to be some business owners sitting here, how's it going to impact me? It could change the cost structure of what they've been paying for.
It
their
may be.
employees.
I don't know.
Right, and
Yeah.
again, this is where, again, it's a marketplace and you're going to have to go out.
Right.
But I think some of the key points is it's going to be a website that lists the different products. They can put in, and if you had 5 different insurance companies or 10 different insurance companies, I don't know if we know yet how many are participating, but you'll be able to look at a bronze plan or a silver or gold or platinum plan side by side
Yeah.
and see amongst those offering who has the best price.
Yep.
And then maybe the one that wasn't getting any business because their plan was more expensive will lower their
Yeah.
prices to get more business.
Yeah, it could very well attract this competition between the insurance products. So they want your business. So hopefully the marketplace will provide a place where competition, transparency, you know what you're getting at the most affordable price.
You had mentioned you right now get in, you can sign up from October 1st through December 15th. Then there's going to be a time where apparently you can't sign up, and then you can sign up again in March, I think you said.
No, you can sign up from October 1st through March. It's a 6-month open enrollment at first.
After March, though, my point was going to be, let's say someone is still being covered, and then in April, their private company they work for says, I'm dropping the insurance, I can no longer afford it. What do they do if they can't sign up on the exchanges at that point and they just were dropped from their private company?
Well, then that would be a change of life circumstance. So I'm pretty sure that they would be able to go and sign up on the marketplace if that's the case. But I think that the companies would probably work with them and not do that until open enrollment comes up.
Well, you would hope so.
You would
But then
hope
if they
so.
can't afford it, they can't afford it. I guess the point would be, in the implementation of anything, there's going to be a lot of confusion. There probably was in 1935 when we started Social Security.
There was, and then Medicare in the 40s, so it's the same.
So that if you have these questions, try to write down what your questions are. You're going to call up these facilitators, if that's the actual title on this, but the people who are being trained by the government to answer the specific questions.
The navigators and the in-person counselors will be located all throughout the state in every community. So once we do have the website, Get Covered Illinois, you can go to it and type in your zip code and find all of the navigators and in-person counselors in your community. And there'll be contact information where you could call and ask questions, places where you can visit. They're there to help you, because yes, this will be confusing. Change, is always hard for some people, and there will be a lot of questions, but that's what these people will be there for.
And I might recommend that people, as they're talking to those navigators, take notes.
Yeah.
Write down who you talked to, what was said, what you were told on what date.
Yeah.
Because invariably what's going to happen, some of these navigators are going to be wrong in what they're saying. I mean, that's just.
Well, we hope not. They're going through very extensive training right now as we speak at both the federal and state level, hours and hours and hours of training. And so they should be equipped to answer your questions and to help you navigate the marketplace.
Well, Jennifer Creasy, thanks for joining us. I know there's a lot of information that's just to be determined. Hopefully, when this airs, we have the website up.
Yes.
And things go hopefully smoothly. But again, we thank you for sharing some of the information.
Yes, thank you for helping get the word out.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.